Good evening. The parents of a young woman who is bedridden with chronic pain are convinced that the BC healthcare system has let them down. They believe that their daughter has Lyme disease based upon test results from labs in both BC and California. They also believe that doctors took too long to properly treat their daughter's condition while her health continued to deteriorate. In the early stages of the disease, they say doctors dismissed the possibility of Lyme disease, some saying it doesn't even exist in BC. And DREWA reports.
This is how 23-year-old Marie McQuay spends her days. The once vibrant young woman is now bedridden, too weak to even walk on her own. Her parents convinced their daughter has Lyme disease, a debilitating illness.
Your greatest fears go through your head and you pray that will never happen, and it has.
Marie's parents say she may have contracted Lyme disease when she was bitten by a tick while hiking the West Coast Trail back in 2002. At the time, Marie recalls getting a nasty insect bite followed by flu-like symptoms. She still kept active, but years later, that changed, and her health began to deteriorate.
She dropped out of college, and 2 years ago, she was unable to attend any longer. She was too sick. And we didn't have any idea what was wrong with her. She had to come home, and that's where she's been ever since.
Jay and Susan McQuay were convinced their daughter had Lyme disease, but say several doctors in BC dismissed their opinion. So taking matters in their own hands, they had Marie tested in the U.S. at a private clinic. That test came back positive.
The disease had already established itself. It was already so far advanced that we're faced, I should say my daughter is faced with the fight of her life.
Lyme disease is a rare bacterial infection spread by a tick bite. In BC, the common species is the black-legged tick found on Vancouver Island, the Lower Mainland, and the Kootenays. The illness usually begins with flu-like symptoms. Left untreated, the disease can last up to several months, causing extreme fatigue. It can also affect the heart, nervous system, and can even cause arthritic symptoms. Fatalities from Lyme disease are rare. However, if the illness is undiagnosed, it may develop into a chronic disease that's difficult to treat.
If you are too late, then it is not that easy to eradicate 100%. If it is totally late Lyme disease, like you leave it for a year and then you want to treat, then treatment would be difficult.
Last year, the BC Centre for Disease Control tested Marie McQuay several times for Lyme disease, and the results came back negative. But the Canadian Lyme Disease Foundation says Canada needs a higher level of testing.
If a person is showing up at the doctor's office with symptoms of Lyme disease, and if they do have one of these positive tests from one of these highly professional U.S. labs, then the doctors have got to take it seriously.
For now, Marie's family is investing in countless forms of medication, supplements, anything that may help their daughter get her quality of life back.
Now, according to the BC Centre for Disease Control, there are no more than 6 confirmed cases of Lyme disease in this province in a typical year. But the Lyme Disease Foundation estimates that hundreds of British Columbians are suffering in silence, that their illness is not properly diagnosed, and they've never been referred for testing. A big part of the problems is that Lyme disease can have the same symptoms as a variety of other medical conditions, from arthritis and chronic fatigue syndrome to multiple sclerosis and even psychiatric disorders.